Hello everyone, welcome back to the anesthesia in rodent module of the rodent neurosurgical aspects, which are most important if your study involves the animal models and small animal model to prove whatever you want to studying whatever you are studying in the neural engineering aspect. So in the last few sessions we have covered all the equipments that are required and the drugs that are involved. How do we select those rats for anesthesia, what sort of monitoring that needs to be done before you subject the rat for anesthesia. So now that the rat has been anesthetized, so in the process of surgery or during the process of surgery or anesthesia, what are the parameters that needs to be monitored to make sure the survival rate is good, so that your surgical outcome is good and you are trying to get the expected data. In neural experiment especially, it's very important that the brain function is maintained as it was before your experiment. So this healthier outcome and a good neural outcome of after all the experimental procedure that you subject the rat to, and then you are going to implant the various materials into the brain or the spinal cord. The data that you are going to collect needs to be really optimal, and that is going to be dependent on the health status of the rat. For example, during the procedure, if there is some hypoxic injury or there is a stroke that is caused by during the anesthesia or by the direct injury by the surgery, all your results are going to be unreliable. Not only that, the entire procedure has to be repeated on a different subject. So it is not only the rat's life that is you are going to lose, it is also that your precious time and effort that you have taken is going to be of waste if the monitoring is not done up to the mark. Alright, so with our introduction we will see what are the parameters that need to be monitored, basic parameters. And as I said, this is going to be a primer. You need to sort of spend a little more time with the introduction that I am giving and then get to know it, and there is significant learning curve with all this. But nowadays the equipments and setup that we have already discussed are very user friendly. You will be able to use it right from the first day, but provided you need to know what those parameters are, what are the principles in maintaining those parameters, what are the physiological function that you need to observe, and little bit detail about that theoretical aspect of those physiological parameters will be discussed today. Alright. So we have covered all these topics in the rodent anesthesia in last two sessions. So today's entire sessions is going to be entirely on vitals monitoring and the postoperative care, which is very important, and that's what is going to decide the final outcome. Alright. So let's look at how there is an impact on physiological status of the animal. For the non-biological students, the word physiology refers to the functional status. Alright. So the word functional becomes a little superficial, and the physiology refers to the entire system physiology. For example, there is cardiac physiology, respiratory physiology, then there is neurophysiology. So these all these terminology refers to the functional status of each individual body system. Alright. So here is an example where the anesthetic agent has the impact on the heart rate. This is just one example. Of course, the other vitals like respiratory and temperature are also going to get affected, and we will see how those are monitored. So I have taken an example where the anesthetic agent has a direct effect on the heart rate. So this I had explained earlier as well. The combination of ketamine and xylazine is going to have a direct effect on the heart rate, which depresses to around 55% of its baseline heart rate. All right, that's how much it has its effect on. And of course, this is a KX with isoflurane is another agent which causes 60% of it. Hence, if you are using the injectable anesthetic agent, ketamine xylazine is preferred, but the vital has to be monitored really tightly so that it does not end up with bradycardia, that is reduced heart rate, which will reduce the oxygenation to the brain by reducing the blood pressure. So, for non-biological students, I would just try to briefly summarize what are all these parameters that I am just trying to list out. Easy to remember, the easy way to remember is T, P, R and BP. These are the 4 vitals that we all monitor even in humans, and the basic vitals which needs to be monitored throughout your surgical procedure, and any parameter that we discuss are directly or indirectly related with these four parameters. All right. So, T stands for temperature, P stands for pulse, R stands for respiratory rate, and BP stands for blood pressure, obviously. All right. So, here if you want to divide the systems, body systems, then the pulse and BP is cardiac system, our respiratory rate is a respiratory system. All right. And temperature is an overall function, but however ultimately controlled by the brain itself. All right. So, you need to remember temperature definitely falls because the basic metabolic function of the rodent's body comes down. All right. So, the BMR comes down. So, the heat generated in the rodent's body will also come down. Not only that, you are blunting the CNS, the central nervous system, which will control the overall temperature, will also come down. So, generally it is a hypothermic state. All right. So, all the critical functions in the body, especially the enzymatic functions, needs a temperature of around 37 degrees centigrade. All right. So, this is tightly controlled in a very narrow range, wherein any higher temperature of hyperthermia, lower temperature of hypothermia, both are detrimental to life. That is very, very important to remember. All right. So, next is the pulse and blood pressure. Obviously, those refers to the cardiac pump activity. All right. So, since I am discussing the parameters, I might as well cover the entire parameters here, wherein I am introducing a lot of terminologies, and it is important to pay attention and remember all these. So, in rat's heart is the range is around 250 to 500 beats per minute. That is a pretty wide range. However, that should be the range wherein you are monitoring the heart rate with a respiratory rate of around 36 to 50 per minute. Okay, respiratory rate going to be 36 to 50 per minute. So, these are very important numbers to remember, and there are many systems which will automatically display these parameters, and not only display it, it will also raise an alarm if the threshold has been set manually within their systems. All right. So, cardiac pump is very important to maintain the blood pressure, which will maintain the cerebral perfusion pressure. All right. So, if the blood pressure falls or the heart rate falls, the blood pressure will fall. When the blood pressure falls, the cerebral perfusion pressure will fall, wherein the oxygenation and metabolites delivery will come down to the brain, and it leads to what is known as hypoxic ischemic injury to the brain. All right. I am trying to introduce a lot of terminologies here, but every single one of them is very, very important to remember to understand the importance of these vital monitoring. So, hypoxia refers to reduced oxygenation, ischemia refers to the reduced blood supply in general. All right. So, what leads to hypoxia? This can be many, wherein oxygen saturation itself will come down, which we will discuss it in detail. Ischemia, obviously, when the blood pressure falls and the heart rate falls. All right. So, all these are intertwined and it becomes a really complex physiology, but then easy to remember if you can at least recollect TPR and BP. The best way is to have a good monitoring system, which will not only help you with the alarms that are happening in a very dynamic range. It also tells you when to stop the surgery, when to abandon the surgery to save the rat's life so that you can at least repeat it later. And it also tells you various side effects of the drugs that you are using, so at least for the next experiment you can improvise. So, as I said, animals should be continuously monitored during the anesthesia with an assistant dedicated to the monitoring. It is not that the operating lab person is going to do everything. It is better you have help to assist with the vital monitoring. And the important thing, as I said, is the respiratory rate and the character. Fast shallow respiration indicates lightening of the anesthetic plane, deep breaths indicate deepening. This is one of the reason, all right, for the change in the respiratory rate and character. All right. So, lightening of anesthetic plane is that the rat is becoming more and more conscious. If you remember the plane of anesthesia that we discussed based on the minimal alveolar concentration, if your dial setting on the vaporizer is on the lower limit, the percentage of the anesthetic gas is also on the lower limit, and then the plane of anesthesia is going to be lower. That is either the loss of memory plane or a loss of consciousness state, which is just superficially just sedated, not really unconscious. So, it is very important to look at the anesthetic plane, and that will be indicated directly either by the MAC or the dial setting that is being given, and if you can monitor the respiratory rate of the rat. So, another important thing is hypothermia. As I said, this will prolong the recovery, and many a times it will not recover completely and then spirals down to death if there is additional components of acidosis and coagulation disorder, coagulopathy. All right. So, this we will discuss it in detail later, but temperature is a very important parameter that, hence, for the reason that I just discussed, you need to provide additional heat at all times when anesthetized and in the immediate recovery period. That is very important. It is not just enough to give the temperature, the heating atmosphere or the additional heat only during the surgery. It is very important that you carry it down to the recovery period until a full recovery happens. All right. So, the reflexes, this is a very important parameter, absence of a pedal withdrawal reflex. If you all remember the illustration I did, and I said when you pinch there is a withdrawal of the hind paw that is happening. This is the most reliable indication of attainment of a surgical plane of anesthesia in rodents, because you are giving pain and you are looking for lack of motor response. Okay. The basic requirement is the rat should not move when you cut the skin. Okay. So, when this pedal withdrawal reflex is attained, that is what you can see, but at the same time it should not be so deep that it will affect the autonomic reflexes, as I just discussed in the last few slides. All right. So, it is always good to have such a rodent anesthesia record, which will also have various details about the surgery. Okay. You can include all the identification details of surgeon, animal's ID, procedure and whatnot. Along with that, you give a detailed description of the actual anesthesia being used, the cocktail being what exactly is the mixture that you are using. If it is ketamine with xylazine, what is the dosages of the same, how much is the volume that you are going to inject, and what time did you really put the rat for induction. So, time is very important, because as the time prolonged, the recovery is also prolonged. So, you can sort of predict the recovery time based on your entire duration of anesthesia. And then it is also nice to use preemptive analgesia, as I said, to blunt the autonomic reflexes, in the sense a response of heart rate, that is tachycardia, and a sudden raise of BP is unwarranted when you make an incision. There is additional amount of pain is given to the rat. So, to blunt that, you can infiltrate the local anesthesia like lidocaine or buprenorphine to blunt that effect due to the pain, so that the vital parameter stays smooth throughout the procedure. And of course, you can also include the details on surgical preparation in the same record. So, the most important thing is that when did the surgery begin, and is there a withdrawal reflex or not, and how is the mucous membrane seen. So, as I said, that will give us an indication of the health status of the rat, which is which depends on the color of the mucous membrane. This was discussed in last session. Generally, pink is very healthy, pale is anemic, and blue is cyanosis. All right. So, cyanosis is due to again reduced oxygenation. So, there is something wrong before you even begin the procedure, and you have to abandon the procedure and look at the cause for this cyanosis. Pale is obviously that the rat is anemic. All right. So, these are the most important parameters that you are going to document every 5 minutes. Starting from 5 minutes, it can go as long as the surgery is. So, you need to document at 5 minutes, 10 minutes, 15 minutes, and the parameters that are used is how much is oxygen that is being used, that is very important, and then percentage of isoflurane that is being used, what is happening to the respiratory rate, how is the mucous membrane during the surgery, when did the surgery end, and is the animal awake or not, and if there are any untoward incidents during the anesthesia or surgery, that also needs to be documented, because all these are going to have a bearing on outcome, surgical outcome or the functional outcome if you are doing the chronic study. All right. And then of course, some details about the postoperative analgesia and care, whether you are going to use isotonic saline or you are going to use the analgesic agent, and if yes, what route, and then a little bit about where did the animal recover and how was the recovery. All right. So, and then the heating source, whether it is there or not. So, it is a sort of checklist that you are trying to maintain along with the monitoring, which is very important, because you are trying to look at the huge anesthetic responsibility, and there is a surgical responsibility going on. You need to set up the entire apparatus. So, I would strongly recommend that you have a checklist, have a written protocol stuck in your lab wall, wherein you know every step what you are using until it becomes automatic for you. It is better to have, I would say checklist is a very important aspect even in human endeavors, and it is more so important in human endeavors. It's a good habit to maintain a checklist and have such anesthetic and surgical record. All right. So, now let us look at what are the apparatus that are available in the market to use for rodent anesthesia and surgery. So, this is one such very good setup where there is a heating pad built into the system, and then there are various gadgets and peripherals which are used to monitor respiratory rate, cardiac rate, and end-tidal carbon dioxide and whatnot. So how are we going to use it? So as I said, these are the broad physiological system that can be monitored with various. This is one of the example by the Keto group, where the modular physiological monitoring uses a suite is available with Physio Suite setup, where they have homeothermic warming with the right temperature peripheral, and there is mouse-stat modular system wherein heart rate and pulse oximetry. All right, I am sure post COVID all of you are familiar with this pulse oximetry, which can be applied on to the paw, wherein it shows SpO2. All right, SpO2 is oxygen saturation, which needs to be at least more than 95%. And then there is a ventilatory parameters check, and of course end-tidal carbon dioxide monitoring. If the EtCO2 is high, that means there is carbon dioxide retention happening in the respiratory system. So then you will have to look into the plane of anesthesia, look at the respiratory rate if it is deep and shallow. So all this has to be monitored when this gives an alarm regarding various parameters. So there is a infrared warming along with this system to maintain the temperature, and the probe that can be used are rectal probes for the mice and rats. So that is a very good peripheral or an accessory device to monitor the core body temperature. All right, and then you can even pre-program it to the set temperature, and then there is automatic feedback control wherein the warming increases if the temperature is falling. That is a very good setup. If that is not there, you can even manually increase the temperature. So mouse-stat is basically dedicated for mice and rats. There is a paw sensors wherein it detects the heart rate and the pulse oximeter, and it also has the option for respiratory rate, and it also has the automatic feedback control. Ventilation parameter, that is very important to look at the ventilation by pressure or volume control. All right, so this decides the delivery of the gas, which is automated based on the pressure and volume control. All right, so this I suggest you do a bit more detailed study on these pressure and volume control of the anesthetic agent, which will give a very good plane of anesthesia and a smooth anesthesia throughout the procedure. So capnoscan is another accessory where it does sample the carbon dioxide in the end-tidal volume. All right, so any retention of increased carbon dioxide means then there is reduced gas exchange that is happening, or increased catabolism throwing the carbon dioxide out more, and then trying to see that the respiratory rate has gone down, which is causing hypercarbia. Hypercarbia is the condition where there is accompanying hypoxia, that is oxygen is reduced and carbon dioxide is increased. All right, this leads to acidosis, respiratory acidosis. All right, so the discussion on these acidosis and homeostasis, electrolyte imbalance is beyond the scope of the current module, but I hope you all read a bit about all the principles that are involved in physiological mechanism for acidosis, so that you can even correct it if there are such instances. All right. So after the anesthesia, how do we really care for these rats? And it is very important, so that there is a continuous care until it makes a full recovery, so that the outcome is good. So animals should be observed continuously until the righting reflex has returned. All right, so there is a withdrawal reflex that is gone, and now you will have to make sure those reflexes get back. And other righting reflexes that when you drop a rat, it automatically prones by itself and then start to walk. All right, if it stays in the same position that you are putting it on into the cage, That means the right reflex has not come back. These are all important postural reflexes which will give us an indirect indication of the status of the central nervous system. Alright. Animal should be returned to a warm draft free cage that is placed on a warming pad or under a heating lamp. So, the temperature is again important in the recovery aspect, not only during the surgery. And animals at different stages should not be put together. It is very important that they are likely to walk around and even trample others when they are in different stages of recovery. And it is better to return to social housing as soon as possible once the rat makes a full recovery. And if the surgery has been performed, the bedding substance should not be able to stick to the wound. This is very important to make sure that there is no infection. Alright, not only that, it can also cause trauma since the wound is raw. Alright, so it is better to use the paper rather than wood shaving or bedding for the post-operative cage, and ensure that the animal is able to reach for water and food sources. If not, then place on the cage floor or consider administering fluids to prevent dehydration. There are various supplements that are available to use. If you think the food and water intake is not good, we need to supplement it in addition to its regular feeds. So, monitor the animal's basic biological functions, that is, how is the food and water intake, how is the body weight, and how is the urination. All this will give us the final clue about the health status of the rat following the procedure for next 2 to 3 days. And if are there any clinical signs of distress which needs to be monitored daily for at least the first week following surgery. So, that is the recovery time, that is 7 days. That is the reason why many experiments give the gap of 7 days if there are multiple implants or multiple surgeries involved. If after every surgery you need to allow 7 days for the physiological system to reset itself to the initial stage. So, during that 7 days, these are all the parameters that you need to check and monitor. And if surgery has been performed, there has to be an analgesic plan to make sure that rat is not in distress, which not only affects the full recovery, and it also makes the rat more irritable. And even if you are planning to do any sort of experimental behavior, it is not going to be cooperative. Alright. So, how do you sort of give a scoring for a post procedural status of the rat? A score of 6 can be given if it is very active, that is curious and fast, but there is occasional breaks, then it becomes just active, and so on and so forth. As the activity goes down, the scoring goes down. This is the very important stage that has to be recognized. The rat will be uninterested in the surroundings, and it is rarely active, most of the time sleepy with a reduced food intake. Alright, that is the sort of alarming state. Unless you identify it, rectify it, and bring it to 5 or 6, it is going to go down very soon. Alright. So, moribund state is almost dead rat. So, death is anticipated if there are breathing issues and there is absolutely no activity. Alright. So, such scoring helps us to monitor the health status after the surgery and to rectify, and it gives a chance to rectify it at the earliest. And other signs that there is a detailed scoring where you can check the body weight and give the scoring, and you can check the breathing pattern, mobility and reaction to stimuli. How is the coat, whether it is ruffled and not clean. Generally it keeps grooming itself so that there is a smooth shiny fur coat. If it is not clean ruffled, it indirectly indicates the rat is not active. And of course, the posture and behavior, social behavior, apathetic and hunched is a very poor indicator and it also tells us that it is in a very poor state. That has to be checked into as to what is causing this sort of a posture and social behavior. And feces also give us the indication of the sepsis. If there is an infection going on, obviously there is diarrhea and the stool starts becoming soft. And then the orifices, if there are crusting of the orifices, which will give us the indirect indication of dehydration. And then you sum it up and have a total score. So this you can monitor on a daily basis with a date and time. Alright, so this has to be done for next 7 days. All these parameters we need to monitor and give a scoring, and it should improve in your next 7 days. Alright. And this sort of a card will generally help us for a quick look as to how and what analysis is administered, is it normal behavior or not, and then you keep signing on it. So that sort of a rodent card can be maintained on the recovery cage. Alright. Another thing is that hydrating gels are also commercially available, and it's very important in the hydration of the rat following the surgery. If you think the feeding, the drinking habit is not adequate, and when you do this skin tenting test where you pinch and the tent persists, that means the rat is dehydrated. Alright. So it's very, very important to maintain the hydration using the hydrating gels, which gives the extra hydration that is required. So as a last session, we'll briefly touch upon the local anesthesia. I'm pretty sure all of you are familiar with this already. The local anesthesia blocks the nerve impulses locally as to wherever we are infiltrating by specifically binding the voltage gated sodium channel in the nerve cell membrane. Alright. If that is the neuron and dendrite, soma, dendrite, the axon and the axonal terminals. So it acts on the sodium channels, alright, and blocks the activity of the nerve cell. And usually the route of administration is topical to mucous membrane or injected directly into the tissues and around the nerve bundles. So local nerve infiltration depends on if there are known nerves which can be blocked, then all the areas which are supplied by that particular nerve will be blocked. Those are called nerve blocks, regional nerve blocks. Alright. If it is directly infiltrated into the tissue like muscular tissue or subcutaneous tissue, then if you are making an incision, the anesthesia is provided only till the depth of that particular plane that you have infiltrated. So administration local prior to painful stimulus would be considered as an adjunct analgesic to the opioid or NSAID analgesics. Okay. So these can be considered together to give a good pain relief. Use as a primary analgesic is discouraged due to its shorter duration. So this is always used in adjunct to the either general anesthesia or the opioid and NSAID analgesic, which will maintain the analgesia. It has a quick onset around 1 to 2 minutes, but it is short acting. Lidocaine as a drug is quick onset and short acting. Bupivacaine is slow onset but is long acting. So usually these are mixed for basically as the same principle of induction and maintenance. Alright. So when used in combination, as I said, lidocaine plus bupivacaine in the same syringe, local anesthesia can be fast onset with a relatively long duration of action. So this is a popular mixture similar to the ketamine and xylazine combination. And for a rodent use, you need to dilute 1 to 2% lidocaine to 0.5% and 0.5 bupivacaine to 0.25% to allow for feasible volumes and infuse at the incision site. Alright, this can be used for scalp block. These are the popular mixtures where a long procedures and a long anesthesia, local anesthesia can be provided if your surgery is going to be within like 5 to 10 minutes of the procedure. And what has been shown here on the right hand side is the nerve block, wherein the nerve which is supplying the skin around the eyes is blocked for any procedures that are performed around the eyes. So this is just an example where a specific nerve can be blocked using the local anesthesia. So that brings to the end of today's session. So to summarize, so we have gone through all and the entire set of the equipments, the monitoring parameters, all the drugs that are involved, and what are the options for injectable anesthesia and inhalation anesthesia, how are we going to monitor during the surgery and anesthesia. So these are in a nutshell how the entire workflow of anesthesia and surgery would work, and I strongly recommend that you read definitely a little more about whatever aspects that I have covered. I have tried to cover the most of the principles involved, but then there are many more details that you need to look into, and many more improvisation that needs to be done to customize it for your particular experiment. In next few sessions we will deal with the general animal handling and how the euthanasia is performed after the surgery if you are trying to harvest the brain. So those topics will be covered in the next few models. Thank you all for the kind attention.